So to kick it off, let's just have each of you give, 10-second, well, it can be a little more than 10 seconds, quick intro on your background in terms of what you do professionally. And Danny, since I just hyped you up, I'll start with you.
Yeah. So that was actually the when you guys released the Stray products. I was in that.
Ah, okay, that event. Great.
That was pretty cool. And he's wearing it right now. He's not really happy about it. Yeah, I've been a vet tech for about 3 years now. When I got my dog, it kind of just blossomed from there, and just wanted to just kind of learn how to take care of my pets better and my family's pets. And it just 3 years later, here I am. And I actually graduated for like information technology, and I'm not doing anything with that right now. So
career changers, gotta love it.
yeah.
Oh, it's great. All right, well, next up, Dr. Robin. And we did actually recruit Dr. Robin specifically from, because she works at a cat-only vet that also carries our travel cat products. So if you didn't know, everyone, we have a store locator on our site, and our products are carried in almost 200 stores across the country and even in other countries outside of the US. And her practice is one of those places that carries our products. So that's how we recruited her. So go ahead, Dr. Robin, and give us your intro.
Hi, my name is Dr. Robin Beatty. I'm a veterinarian, and I've been a veterinarian for almost 3 years now. I work, like Emily said, in a feline-only practice in Columbus, Ohio. It's called Cats Only, and believe it or not, people still call and ask and see if we will treat their dog, their gecko, whatever. And even though in our name it says Cats Only, so.
Oh my gosh. Okay. Dr. Mansom, and I think actually we recruited as being an attendee. Is that right? Or maybe if we saw you on Instagram, remind me how Instagram we recruited you from. Yes, awesome. Well, give us your background.
Hi, I'm Dr. Mansom. I'm in Vancouver, Canada. I have a 12-and-a-half-year-old adventure cat. So that's probably how he found me, because I was posting pictures of him hiking and paddleboarding with me. And I graduated in 2010. I have a special interest in making cat carriers more comfortable, less stressful for cats, and also a special interest in preventing house soiling.
Great. All right, cool. So maybe just starting with the two doctors, what are some of the best ways that you recommend people can monitor their cat's health? Like knowing when something could be wrong or is wrong, like what are things to look for? And maybe I'll just throw it right back to you, Dr. Mansom.
Yeah, the simplest thing that you can do at home is to monitor how much your cat eats and drinks and pees, because simple things like your cat suddenly eating less can be a sign that something's going on. It could be in pain, it could have an infection, it could be constipated. Like there's a whole list of things that could be going wrong. The same with drinking. So diabetes, kidney disease are two common things that cause increased drinking. And if they're drinking more, they're usually peeing more as well. So yeah, those are really important things to check for. And one of the reasons why I don't recommend free feeding food, just like what Jackson Galaxy said, is, well, in addition to not being able to train your cat as well, if you just free feed food, the other reason is if you free feed food, it's hard to tell how much they're eating, because the bowl just sits there all day and you keep filling it. It's hard to know how much they're eating.
Great. Dr. Robin, would you have anything different to add to that?
I would agree with everything that was said. I would also add in that changes in behavior is also important to watch too. Sometimes we have cats that the only presenting complaint is that they've been hiding under the bed for the past, day or so, and they come in and they're very, very ill, and that's the only symptom that they've had. So watch your cat very closely for changes in their routine, their behavior, just like eating and drinking, but also if they're just not wanting to play with their toys, or, like I said, hiding more is a good thing to watch for.
Yeah, lethargy, right? Like that, if it's combined with other things. So Danny, I'm going to ask this question a little ironically, because I feel like people ask it a lot. And I know there's some stat about this that, people take their cats to the vet at a much, much lower rate than dog parents do. Is it really important that I take my cat to the vet once a year, especially if they hate it?
Oh yeah, absolutely. I always recommend the routine visits. You never know what's going on with your cat. They don't like to show that they're in pain at all, we get a lot of clients that come in and they're just for routine visits, and we do some blood work and stuff. And we found out, some things aren't always greener on the other side. And all of a sudden your cat has UTI and you didn't know that, or your cat's got something going on. And it's just really important just to bring your cat in, get them checked out. And it also helps get the cat used to going to the vet as well. Always recommend, even from a kitten stage, like bring your cat every 6 months, every year, whatever your doctor recommends, because every word is different.
And
We all-
go ahead.
Oh, sorry. We all have to do things we don't like. We all have to go to the dentist, the eye
Yeah.
doctor. So,
Yeah.
you know,
It's true.
good
It's a
for
good
them.
way of thinking about it,
Yeah.
right? Like, because I do think some people, they get that kind of anxiety of like, oh, I don't want to be like mean to my cat, but it's kind of the same thing of like forcing your parents to like get checked up and go to the doctor, right? It's just, it might be uncomfortable, but in the long term, it can be good, right? Can each of you share a quick tip that you have in terms of keeping cats calm and comfortable and making it at least as less stressful as possible? Dr. Robin, maybe we can start with you.
Yeah, I really like Feel Away. I use it in my clinic all the time. We have Feel Away diffusers, so basically synthetic pheromone diffusers, and that can help really keep them calm at home. You can even buy that or buy a similar product and spray it on towels or blankets to put into a carrier, using blankets or towels from your house as well to place into your carrier to make your cat feel more comfortable. And then I also, while they're there, I like for people to bring treats or snacks that their cats really like. I mean, I always have some in my exam rooms, but I like it better when they have their own. And so that way I can give them lots of treats and praise and make their experience as much of a fun experience as I possibly can.
Great. Dr. Manson, what about you? Any other tips for making it comfortable?
Yes, carrier training your cat. So getting your cat used to the carrier before you actually leave for the vet, to go to the vet clinic. A lot of people take it out right before their appointment, and the cat sees it and goes, "Oh God, I'm going to the vet clinic. I don't want to go. I'm going to go hide under the couch instead, or the bed." So I would take it out at least several days before the appointment if you don't already leave it out all the time, and get them used to it, because if you wait till the last minute, you're probably going to show up to the vet late or not at all.
Right.
Yeah.
And Danny, how about you? What are your tips for making it comfortable?
I agree with everything they said. I'm also more on the side of the quietness. The cats don't like sudden movements. They're uncomfortable. I approach all the cats slow, just kind of with a monotone voice. I don't like to raise my voice to them at all. Because I've had doctors come and barge in, they're in a rush, and all of a sudden the cat's scared. He's not sure what's going on. So I like to approach it calm, quiet, collected, just kind of read the cat. The treats, oh my God, every time I give a cat treat, they don't trust me when I give them treats at all.
Well, I will also share personally with our cat Andy, who again, she inspired us to start the company. She's been sleeping in the Meowable home the entire event so far. She is on the shit list at our vet. We actually have to give her gabapentin before coming in because she hates it that much. So if that's not something you've discussed with your doctor before, it might be something to bring up if you're not aware it's an option of if your cat is so, and it's honestly for the vet's sake also, and not just for Andy's sake because she goes a little nuts. I do also want to just take the opportunity to share the Transporter, because we call this the ultimate calming carrier. And part of that is because this shade comes down, it's all dark on the inside, but also it's really good for vet visits because it has this sliding tray. So instead of having to pull your cat in and out, you pull the tray in and out. And so this is really meant for stressful situations like the vet or airline travel. It makes it much easier. And this is actually a new one, as a new in my house, because we wanted to show off the newest colorway, but our cats sleep in this all day. Like they fight over it sometimes. So it also really acts like a bed. And it is got a seamless lining that is waterproof. So if there's an accident, it's easy to clean. And this is also washable. So this is real, and you can carry it like a backpack, a bunch of cool features here, but
Excellent design.
Thank you.
Excellent.
Yes, thank you. Yes, I'm very proud of that one. We worked really hard, and that was, all the products that we make, we work with the community to come up with, solving problems that we know people have or that we have ourselves. So Dr. Mansom, so you mentioned, right, you actually go out with your cats as well, right? And so we know that there are risks to taking your cat out, but there are also a lot of rewards. And so we'd love to hear just from your perspective as a vet, why you think it can be a good idea to take your cat out, and just any specific tips you have, like from a vet's perspective on, how to take your cats out in a safe and responsible way.
Yeah, definitely. It's really good exercise. So cats in the wild spend a lot of time hunting. And now that they live in people's homes, they spend most of their time being couch potatoes and get overweight really easily. So when you take your cat out hiking, for example, they're getting exercise, also fresh air, mental stimulation. Yeah, I mean, you don't want them overstimulated, but if you take them out in a carrier and they're overstimulated, they can go in and hide and take a break. And once they're more comfortable, they can come back out and get some more fresh air. And yeah, I think it's great. It's a safe way for them to go outside, because cats that roam around outside unattended can get into all sorts of trouble. They can get bit by other animals. They can get caught in traps. They can get lost. They can it can be really unsafe when they're outside unattended.
Right. And Robin, Dr. Robin, a question we got is someone said, I'm concerned about flea and tick products that are both effective and safe for cats in the long term. Do you have any recommendations? That was one of my recommendations in the beginning, like make sure that they have that. Do you have any brands or things to just think about or look out for when it comes to flea and tick meds?
So I would make sure, one, that they're labeled for cats, and two, I would reach for one that your veterinarian prescribes rather than an over-the-counter one, just because those tend to be a little bit better quality control and things like that. Generally, especially if you have a cat who's going outside, and depending on what part of the country that you're living in, you want one that has a heartworm prevention as well. So some particular brands that I like are Revolution Plus or Advantage Multi.
So we use.
Yeah, I like both
Great.
of those. They have lots of studies to show that they're safe and effective, and I find that they work for a lot of cats.
Wonderful. Let's see. Oh, Danny, this is a question I thought maybe you have an answer for this. I know you're 3 years in, but is there any particular object that you find cats eat the most accidentally, in terms of I feel like that's one of the biggest things with cats and dogs, is going into the vet because they ate something. We actually had that situation with our cat recently. Is there anything you find that's kind of something that you see a lot that you feel like people might want to think about avoiding or keeping off the floor?
To be honest with you, marijuana. And it goes for dogs too. They eat marijuana, and it's not good ever.
Okay. All right.
Yeah.
Either the doctors, do you have other objects that you find people, cats, especially Dr. Robin, just since you're at a cat only vet?
Well, yes, string is a big one. Actually, my boyfriend just pulled 2 feet of string out of his cat's intestines last week. So big deal. Keep string away from cats. They love to eat it. You think that they're not going to, but they will. And then it gets stuck in their intestines and it has to be an emergency surgery. So that's my real big one, honestly.
And actually, I'm going to stick with you, Dr. Robin, for another question, because I think you were the one that mentioned this, but somebody asked, how do you transition away from free feeding? So I think people might know that that is something they should do, but struggle with like how to go about that.
Yeah. So one, I would talk to your vet about the correct amount to feed your cat. What we like to do at my clinic is actually calculate out calories for cats and measure out their food based off of the caloric content of their food. So once you know exactly how much that your cat should be eating, depending on, its weight, if it needs to lose weight, maintain its weight, gain weight. And then the other thing I would do too is focus more on feeding lots of frequent small meals throughout the day. That's what cats really do in the wild, is they hunt a lot and they eat small, tiny meals. So, start with giving lots of small meals throughout the day so they get used to having mealtime, rather than just like putting food out once in the morning and maybe once in the evening, because that's not really what they would do in the wild.
Okay. And another question, I'll make it a little more broad. Dr. Mansom, I'll direct this to you. Any thoughts on CBD oil or CBD products? Someone specifically asking about, using those to ease car anxiety. Do you find that CBD products can be something that's safe and effective for easing anxiety?
So CBD is not actually FDA approved for cats or animals yet, and it's the same in Canada. So Health Canada and the FDA have not approved CBD for pets. So vets are not legally allowed to recommend CBD. There are some pets that I've met who, like the owners told me, I try CBD. In my opinion, or from what I could see, it didn't really help. Gabapentin works much better. So yeah, I would talk to a vet about gabapentin over CBD.
Great. And let's see. Okay, so Jackson talked a little bit about food. So I did want to bring up food as well. I know that's something Jackson has said, and he's not a vet. So I want to just go to you guys, the vets, with the question. You know, he has said before that the worst wet food is better than the best dry food. And so dry versus wet is often a thing that comes up. So I'm curious if any of you just want to share some thoughts about, you know, moisture for cats. We know it's really important. So yeah, thoughts on dry versus wet food. A hot topic. Anyone want to take that?
Yeah. So the cat tongue is not that great for drinking water. Like one lick is like one snowflake. So you imagine, like, you know, how many licks they'd have to take to get enough water. So I definitely agree with Jackson Galaxy. Like, I definitely think it's important to feed wet food, at least 50% wet food.
Great. Dr. Robin, do you have any other thoughts on?
I think that feeding wet food is ideal, yes, because it has higher moisture contents. I think it sometimes depends too on the cat. I have cats, my own cats, who will not eat any canned food at all. And I have tried multiple different things, and I would much rather them eat something that's nutritionally appropriate for them than nothing. So I agree. I think that canned food is definitely better, but you also have to take into consideration the individual cat's needs.
Great. Danny, any thoughts on that as well? And, or, you know, any alternative things that you've seen is just say if like people are mostly feeding dry food, like other ways to get moisture into the diet?
Yeah, I like to add the water, a little bit of water in the dry food as well. Sometimes you can heat it up for like 10, 15 seconds, warm it up a little bit, kind of mix it up, and it kind of makes the wet food, and that kind of helps too.
Yep. And if you guys have questions, I've been taking them from the Q&A box. So if you have a question as we're wrapping up, please put those questions in the Q&A box. And also, just so you know, the prize we're going to be giving away at the end of this session is a prize pack from Base Paws, which is a cat health and DNA test. So stay tuned to the end if you want to be, have a chance to be picked to win that prize. Would love for each of you to share sort of a cat health misnomer or misconception, or something that you just often find you're correcting people about, or like clarifying, or that sort of thing. Dr. Robin, do you want to start?
Yeah, one thing that I hear all the time is that, oh, my cat pukes every week. It's just a cat. Cats are supposed to puke. They puke all the time, and that is not normal. Cats are not supposed to puke that often, or to vomit that often. Generally, if they're, my kind of rule of thumb is if they're vomiting more than a couple times a month, that could be a sign of an underlying allergy or a GI disease of some variety, and you need to talk to your vet about further diagnostics or something to do to kind of work that up.
And I think a lot of people, maybe they think it's like a hairball situation, right? Is there a way to sort of tell the difference between a hairball and vomit, or is it technically the same?
Well, technically the same. I mean, cats really,
Okay.
they should be passing hairballs through their GI tract. If they're constantly throwing up hairballs, then that could be a sign of a GI motility problem.
Okay. Dr. Manson, what about you? Some things that you want to dispel so you have an audience to do it.
Yeah. So cats eating grass. I know that some cats really like eating grass, and if they eat too much of it, it can make them puke. It can also get stuck in their bum. I've had to pull long blades of grass out of my cat's bum before. Also, I had to remove blades of grass in the back of cats' throats. Because they swallow the grass too quickly. Like it's almost like they slurped up the blade of grass, like, and then instead of it going down into, you know, the esophagus and then into the stomach, it one piece of grass and one cat was actually stuck between the esophagus and the upper palate. Another cat had grass stuck in the back of the throat, going up into the nose. And the thing with grass is that the sides of the blade of grass can be quite sharp and can cut into the soft tissue. So if you see your cat gagging, retching, like after eating grass, don't ignore it. Take your cat to the vet, because a lot of times like the grass can, it can't physically come out because it's like almost designed to get stuck in there.
Hmm. Great, great. Danny? Oh, did you get, oh, there you go. Go ahead. Did you get a little, did you get, can you hear me? Yeah, you're good.
Oh, you're good. What was the
Yeah.
question again? I'm sorry, I lost.
Oh, no, it's okay. Just like a general thing that you want to clarify that you hear people getting wrong a lot about cat health, or just things you hear that you're always kind of correcting people about when it comes to cat health.
Oh, they pretty much touched everything that I was gonna say.
Okay, okay, sure, that's totally fine. All right, and again, we have a couple more minutes before we pull the prize and switch to the next session. So again, let's see. Let's see. And let's do like rapid fire on these. So I'll let just whoever jumps in first, and you can answer it quickly because I see a bunch more questions. Anyone have thoughts on complete raw diets? I've run into vets who knee jerk that. Yeah, anyone want to share how they feel about raw diets?
I think it depends on how your cat looks. Like if your cat's skin and hair coat look great, if there's no vomiting, they're doing well, and that's great. If your cat, is underweight, has lots of dandruff, and I would talk to your vet about trying something else.
Let's see. Tips for cats with urinary tract infections. Anything that you can do besides giving them prescribed food?
I mean, increasing the amount of water that they take in if you can. So again, going back to canned food is a good idea, or thinking about putting out lots of water bowls, or even water fountains, just to increase the amount of water that they're taking in to keep them hydrated.
Somebody had, oh, go ahead.
I would add an extra
What was
litter
it?
box. Yes, add an extra litter box.
Okay, yeah. So for cats, for wet food, is it okay to switch the types of flavors? Like, do you recommend switching or staying within the same brand, for instance, but switching flavors? Is that okay? Recommended? More so just sticking with the same flavor all the time?
It depends on the cat. Some cats have a more sensitive stomach, and even if it's the same brand, the flavor can have different ingredients that can upset the cat's stomach.
Okay. I, for instance, I know that my one cat, we can't switch him because we find diarrhea situation when we do. So we stick him on the same food all the time. Our other cat, we could have switched her with all different meats and whatever, and she was fine. But now it's important to let's see. There's a lot more questions. Let's see. Somebody just asked, is it normal for our cat to be so vocal? She meows a lot. Anyone have thoughts on that? Is meowing too much ever a thing?
Yes. So it could be a sign of hyperthyroidism, high blood pressure, and also, unfortunately, cats can go senile. So I would definitely get your cat checked by a vet.